before we go, I wanted to again catch up with the man behind the Pandemic Pondering blog. We've been talking a lot with Dr. Jim Baker, the immunology physician and Ruth Dowdone professor at the University of Michigan. Doctor, good to talk to you again. And I was eager to talk to you, given that we are right now at the height of cases that we've seen since the start of the pandemic in Michigan. But you wrote last week on your blog, and you are not one to really go out on a limb or make crazy predictions, but you said 2022 is the year this pandemic ends. Kind of give me a reasoning on that and how you got there.
Yeah, when we talk about pandemic, this huge wave of infection that goes around the world, we usually see a couple of phases. And initially, there's a phase where you have a lot of mortality, a lot of people who are very susceptible, dying rapidly. Then you evolve to a more contagious virus that's still very pathogenic. That was Delta. And now we're seeing sort of the winding down. And when I say that Omicron is very typical for this, the virus is very contagious, but isn't as pathogenic because if it killed off all its hosts, it couldn't propagate anymore. And the more people are immune to the virus, the more that they have a vaccine or have a natural infection, the less likely they're going to have a severe effect from this. So we see these downward waves as the pandemic burns out.
Does that not sort of negate the potential? I mean, don't we assume that there are other variations and mutations coming?
Well, there will be, but the fact is that we have more and more immunity and broader immunity with each wave. So that in fact, you've probably seen reports that Omicron is very effective in preventing people from getting Delta. So as you get a less severe form, a less pathogenic form of the virus, it's helpful to protect you. And in fact, Omicron would be sort of what we would have developed if we tried to make a live virus vaccine against coronavirus, because it seems to preferentially replicate in the nose and the upper airway and not in the lungs. So you don't get the serious pneumonia that you did with Delta.
That's been my experience. It's been like a bit of a sort of a head cold. But as I mentioned to the governor earlier on the program, should I be concerned that the percentage of people who are in the hospital who are unvaccinated keeps getting a little bit lower? When it started out, it seemed like it was the hospitals were 75% people who hadn't had the vaccine. Now it's 62, 61%, according to the most recent numbers that we have from Beaumont. Is that a worry?
Well, I think there are a couple of things. Number one, there's so many people infected. We're actually seeing people admitted to the hospital with Omicron and not because of Omicron. And we see that particularly in the pediatric population. There is an enormous amount of infection in children right now, but we only have 110 people children as of today in the hospital. And most of those kids were in for other things. So we're seeing a lot of people admitted with the virus, but not for the virus. The other thing that I think is reassuring is that it appears that not as many of the people who are infected, even if they aren't vaccinated, are requiring ICU care. So in fact, the overall, both the treatments are better, and it seems like the virus is less severe when you get infected.
Lastly, Doctor, the other thing I wanted to make sure we talked about was there's been a lot of talk about other boosters that are going to be necessary. We've heard talk out of Israel that a fourth booster is coming along, and you kind of took issue with that on one of your recent posts. Number one, that it was maybe irresponsible to talk about that kind of thing yet, given that there hasn't been a lot of efficacy studies on it yet, but you're also not sure that that's really the course that these viruses typically need or demand.
Right. The Israel report, which gained a lot of notoriety, was about 150 people after 1 week of vaccination. So I don't really think that tells us anything right now. The Israelis are looking entirely at antibody neutralization, which we're finding out, especially with Omicron, is probably not the primary means of protection. Cellular immunity, I think, is more important. And long term, it may be that we need a different vaccine if there's a lot of mutation, or a different schedule of vaccines.
Yeah.
You know, I think right now we've done as well as we could do with the current Omicron wave, given our primary vaccines. And in fact, they're better than the flu vaccines in terms of their protection. So I think we need to take a step back at this point and really see what comes next.
Well, when we're standing in what feels like the worst of it so far when it comes to caseload, it's nice to talk to somebody who sees the light at the end of the tunnel. Doctor, thanks so much for talking to us again. I know we'll talk to you again soon.
All right. Well, thank you.